Now, the Nursing and Midwifery Council this week proposed that nurses should face 3 yearly checks and those not up to scratch should be banned from working. A similar system, carried out every 5 years, was introduced for doctors last year. The standards in our hospitals are under intense scrutiny after a string of critical stories, most prominent of which was the damning inquiry into care failings at Stafford Hospital, which called for a fundamental change in the culture of the NHS to put patients first. The controversial Liverpool Care Pathway, developed to support people near death, is also being phased out after reports of patients being mistreated. But are our hospitals becoming uncaring places, lacking in compassion? Bishop Michael Nazir-Ali thinks so. This is his Sunday Stand.
The newspapers are again full of stories about patients being left on their own without being able to quench their thirst, without assistance in going to the bathroom, and without help even in being turned over so they don't get bed sores. Some are left even without essential treatment. We have become hardened to such stories of neglect. It seems now that compassion is not such a priority in some of our hospitals. An overly academic approach will not necessarily lead to better care. Learning from the experience of those who have compassion at the heart of what they do will. Jesus healed people, but he also had compassion on them. There is a huge difference between the clinical judgment that a certain treatment is now of little use and the withdrawal of food and water. One of the things that the Liverpool Care Pathway has been criticized for. Every human life is sacred and must be respected to the last moment. No one should be deprived of consciousness except for the gravest of reasons, and thirst must never be left unquenched. Any review of patient care must have compassion and respect for life at its core.
Bishop Michael, Evan's big point is these stories of terrible care, of cruelty, are the exceptions, and that there isn't a fundamental problem with compassion in the system.
Well, I think the problem is this. People may have compassion in their hearts or their minds. How do we know? Compassion has to be translated into care. And I think that is where we are failing. Some of this has to do with appropriate training. So in the old days, with the Florence Nightingale system, nurses were trained on the job. Compassion and care of that sort are caught, not taught, if you see what I mean. With the sort of more academic approach now, with nurses training happening in universities and so on, that's good because they are grappling with the science and so on, but they're not getting that hands-on caring, that translation of compassion into care.